What if I told you that some of the medical checkups most seniors are told to get every year could actually shorten your life instead of saving it? It sounds unbelievable, but new research shows that as many as 37% of tests given to people over 70 lead to unnecessary treatments, painful complications, or even long-term side effects. And here's the shocking part. One of these so-called routine exams is responsible for nearly 5% of all cancer cases in the United States, the same risk level as drinking alcohol every single day. Most people believe the more checkups you get, the healthier you'll be, but the hidden truth is that some of these tests can quietly ruin your quality of life, drain your savings, and leave you worse off than before. Almost no one over 70 realizes they're being over-tested until it's too late. That's why in today's video, we're pulling back the curtain. We'll reveal 5 common health checkups seniors should avoid, all backed by real science. And trust me, you won't believe what shows up at number 2. Before we dive in, drop a comment below with your age and location, and let us know if you've ever regretted a medical test. Don't forget to like this video and subscribe for more essential health insights. Now, let's begin with the first test on the list. You've just heard how some routine medical checkups can do more harm than good. Let's start with one that seems completely harmless. At first glance, the bone density scan. Doctors often recommend it once you turn 70, especially for women, and the logic sounds, simple: measure how strong your bones are, then take action before a fracture happens. It's marketed as quick, painless, and even reassuring. But here's the uncomfortable truth. After age 70, this test rarely helps, and it can quietly set off a chain reaction that damages your health more than protects it. The scan, officially called a DEXA scan, measures how dense your bones are. If the numbers look low, many doctors prescribe medications such as bisphosphonates to strengthen the bones. On the surface, that sounds like a smart move. Yet, studies reveal a very different picture. In older adults, nearly everyone shows lower bone density, not because they are sick, but because bone loss is a natural part of aging, just like wrinkles or gray hair. Instead of accepting this normal process, the system often pushes seniors into lifelong medications that bring their own risks. Here's where it gets concerning. Bisphosphonates can trigger jaw necrosis, a rare but devastating condition where parts of the jawbone literally begin to die. They can also cause chronic irritation of the esophagus, painful digestive problems, and in some cases lead to brittle bones that break in unexpected ways. And despite these risks, the benefits are shockingly small. One large study of women over 70 found that 5 years of treatment reduced fracture risk by only 0.3%, a result so small that most patients felt no real difference in daily life. To see the impact more clearly, consider Rose, a 6-year-old retired piano teacher. She had never suffered a fall, walked daily, and felt perfectly fine. After a routine scan, her doctor diagnosed her with osteopenia, a mild reduction in bone density. Almost immediately, she was put on bisphosphonates. Within months, Rose developed severe reflux and constant jaw pain. She stopped playing piano, the very activity that gave her joy and kept her active. Only after stopping the drugs and switching to lifestyle-based care, vitamin D resistance training, and calcium-rich foods did she regain her strength and return to performing. What this shows is crucial for people over 70 who aren't falling, aren't in pain, and remain active. A bone density scan can create more fear than benefit. Worse, it can trap them in a cycle of unnecessary treatments that lower their quality of life. By contrast, lifestyle changes, strength training, balance exercises, proper nutrition have been proven to reduce fractures by more than 20%, a result far greater than any pill or injection. So, while the test itself might look harmless, the reality is far different. It often opens the door to anxiety, costly medications, and side effects that age you faster than time itself. And if you think that sounds troubling, the next checkup on our list is even scarier. It doesn't just risk your comfort, it could push you toward brain surgery you never needed in the first place. If the risks of a simple bone scan surprised you, the next test is even more unsettling. Let's talk about the brain MRI for memory loss. At first glance, it sounds like the perfect tool after all. Who wouldn't want a detailed image of the brain when memory starts to fade? But here's the problem. For people over 70, an MRI rarely provides answers that improve your life. Instead, it often sparks unnecessary fear, additional invasive tests, and sometimes even brain surgery that doesn't solve the problem. The reasoning seems logical. You forget a name, misplace your keys, or feel a little foggy, and the doctor orders an MRI to rule out something serious. Yet studies show that the vast majority of MRIs in older adults simply reveal normal age-related changes, tiny white spots, slight shrinkage, or harmless structural differences. These findings are not dangerous, but once they're spotted, the cascade begins. Doctors feel pressure to investigate further. Patients panic at the phrase abnormality, and suddenly you're facing spinal taps, biopsies, or neurological consultations you never actually needed. The numbers are striking. In one study of over 3,000 seniors aged 70 to 85 who had mild memory complaints, 86% of MRIs showed some form of abnormality, but only 3% of those results pointed to a treatable condition. That means nearly everyone left the doctor's office more anxious than before with little to no benefit. Even worse, about 12% were pushed into invasive procedures that carried their own risks of infection, complications, and emotional trauma. Consider George, a 74-year-old retired engineer. He was sharp, still fixed things around the house, but noticed he misplaced his keys more often. His doctor ordered an MRI just to be safe. The scan revealed white matter, changes common in people his age. George panicked. He convinced himself he was developing dementia, stopped driving, and withdrew from his community. Yet when his memory was tested through simple paper-based exams, his results were perfectly normal. Once reassured, and after focusing on sleep, hydration, and mental exercises, George regained confidence and stability. His brain wasn't failing him, the system was. This is why experts now advise caution. Unless you have severe symptoms like sudden confusion, seizures, or rapid personality changes, an MRI is rarely the best first step. A safer, cheaper, and often more accurate approach is a simple cognitive screening test that evaluates memory and attention. These tests avoid unnecessary fear while guiding doctors toward real problems if they exist. So the lesson here is simple. Not every picture tells the truth, and sometimes the image itself can cause more harm than the problem you feared. Now, I'd like to hear from you. Have you or someone you know ever gone through a medical test that created more anxiety than answers? Share your story in the comments below. Your experience might help someone else avoid the same trap. And if you're finding this eye-opening, don't forget to hit that like button. It helps us bring these hidden truths to more people like you. Coming up next is test number 3, and it targets the very thing we all fear most, our hearts. Stay tuned, because this common checkup has sent thousands of healthy seniors into unnecessary surgeries. After looking at the hidden dangers of brain MRIs, you might think the worst is behind us. But the next test on our list proves otherwise. Let's turn to the cardiac stress test, a procedure many seniors undergo when they feel even mild fatigue or chest tightness. On paper, it sounds like the ultimate safeguard: test your heart under stress and catch problems early. Yet, once again, the reality is far more complicated, and for those over 70, often harmful. Here's why. A cardiac stress test involves walking on a treadmill or taking medication that mimics exercise while your heart is carefully monitored. The goal is to spot blocked arteries before they cause a heart attack. It seems responsible, even life-saving. However, as with the other tests we've discussed, the trouble lies in accuracy. For adults over 70 false positives, results that suggest a problem when none exists are alarmingly common. In fact, studies show that the error rate can be as high as 40%. That means nearly half of the seniors who take this test might be told something is wrong when their hearts are perfectly fine. And what happens next is where the real danger begins. A suspicious stress test often leads to follow-up procedures, angiograms, catheterizations, even stent placements or bypass surgery. These are invasive interventions, each carrying serious risks like bleeding, infection, or kidney injury from the contrast dyes used in imaging. Instead of saving lives, many of these procedures end up prolonging hospital stays, draining energy, and lowering overall quality of life without adding a single extra year. Consider the case of Raymond, a 75-year-old retired postman. He stayed active, walking several miles each day, but admitted to occasional fatigue on uphill climbs. His doctor, wanting to be thorough, scheduled a stress test. The results were unclear, and before long, Raymond was undergoing a catheterization. A mild narrowing in one artery was found and a stent was placed. That night, he developed complications from the contrast dye, leading to kidney problems that kept him hospitalized for almost a week. The most shocking part, his original fatigue had nothing to do with his heart. He simply needed more hydration and rest between meals. Stories like Raymond's are not rare. A 2017 study published in JAMA Cardiology revealed that more than half of all stents placed after stress test referrals were unnecessary. Patients showed no significant improvement in survival or even day-to-day comfort. What they did experience was higher rates of complications and more hospital visits. So what's the better path? For seniors without classic warning signs such as chest pain during activity or shortness of breath from light exertion, safer alternatives exist. A resting EKG can reveal abnormal rhythms without the stress or risk, while a coronary calcium scan provides valuable information about plaque buildup with far less danger. These options reduce unnecessary panic while still protecting your health. The key takeaway is this: not every test that promises peace of mind delivers it. Sometimes the very tools designed to protect us can quietly harm us instead. And if a heart test can be this misleading, imagine what happens when the procedure involves your entire digestive system. Up next, we'll uncover the risks of colonoscopy after 70, a test many assume is essential but may actually cause more pain than it prevents. If the cardiac stress test reveals how easily seniors can be pushed into risky heart procedures, the next checkup exposes an even more troubling reality. Let's talk about colonoscopy. For decades, it's been considered the gold standard for detecting colon cancer, and many people believe it's non-negotiable once you reach a certain age. However, once you cross 70, and especially after 75, the balance between risk and reward changes dramatically and not in your favor. To begin with, the preparation alone is tough on older bodies. Strong laxatives used before the procedure can cause severe dehydration, dizziness, or even kidney damage. For younger patients, this might just mean a day of discomfort, but for seniors, it can spiral into serious health crises. And then there's the sedation. Older adults are far more vulnerable to cognitive side effects, sometimes experiencing confusion, memory issues, or even lasting impairment after anesthesia. What's supposed to be a routine, precaution can leave lasting scars on both body and mind. The procedure itself carries its own dangers. While colonoscopies are meant to detect polyps and prevent cancer, the scope can sometimes tear the bowel wall, trigger bleeding, or disrupt heart rhythms during sedation. A large 2019 study of more than 1.3 million Medicare patients found that for every 1,000 colonoscopies performed on people over 75, only 2 lives were saved. By comparison, over 20 individuals experienced serious complications. That's a 10-to-1 ratio, 10 times more harm than help. The story of Dana, a 73-year-old grandmother, makes this painfully clear. She had no family history of colon cancer, no bleeding, no symptoms at all. Still, her new doctor insisted she undergo a routine colonoscopy. A small polyp was removed and she was sent home. But that night, Dana collapsed from severe abdominal pain. Doctors discovered a bowel perforation, a hole in her intestine caused during the procedure. She spent 9 days in the hospital, lost weight, and never fully regained her strength. What makes this even more tragic is that she had already had 2 clean colonoscopies in previous years. There was no medical reason to put her through the ordeal again. So what's the smarter approach after 70? Instead of jumping to colonoscopy, safer alternatives exist. A stool-based test, like the FIT test, can be done at home, requires no sedation, and still detects most concerning cases. For many older adults, this simple method is not only more comfortable, but also more effective in preserving overall health and independence. The U.S. Preventive Services Task Force even recommends stopping routine colon cancer screenings after 75 for those without symptoms. The bigger lesson is, this longevity is not just about finding disease, but about maintaining quality of life. Forcing seniors into high-risk procedures that offer little benefit undermines the very goal of preventive care. And if a single test like colonoscopy can carry such a heavy burden, imagine the risks of scanning the entire body at once. That's exactly where we're headed next with the most overused and potentially dangerous checkup of all, the full-body CT scan. If colonoscopy after 70 shows how a single procedure can bring more pain than protection, the final test on our list reveals what happens when the entire body is put under the microscope. Let's talk about the full-body CT scan. It's often sold as the ultimate peace of mind, marketed in executive health packages or private clinics as a way to catch cancer early. But for seniors, this supposed safety net can quietly become one of the most dangerous traps of all. To start with, the radiation exposure is staggering. A single full-body CT delivers the equivalent of 500 chest X-rays in one sitting. For an older adult already more vulnerable to cumulative damage, that dose is not just unnecessary, it can actually trigger new cancers. In fact, research now suggests that up to 5% of all cancers in the United States may be linked to the overuse of CT scans. That places them in the same risk category as daily alcohol consumption, a comparison that should stop anyone in their tracks. But radiation is only part of the story. These scans are so detailed that they almost always uncover harmless nodules, cysts, or calcifications, tiny irregularities that are simply part of aging. Once seen, however, they cannot be unseen. Doctors feel compelled to investigate, patients panic, and suddenly what started as a routine scan snowballs into more imaging biopsies and sometimes even surgery. Each step carries its own risks, and too often the final answer is, it was nothing to worry about in the first place. Take Marcus, an active 80-year-old who once taught martial arts to seniors. He felt great and decided to invest in a premium checkup that included a full-body CT. The scan revealed a 3-millimeter lung nodule. Within weeks, Marcus had been referred to oncology, scheduled for a PET scan, and sent for a needle biopsy. The result, benign. But the biopsy collapsed part of his lung, leaving him hospitalized and in recovery for 2 months. His health and independence, once his pride, were suddenly stripped away, all because of a test he never needed. So what should you do instead? Experts agree, full-body CT scans should not be used for general screening in people without symptoms. If you're coughing up blood, losing weight without reason, or experiencing unexplained swelling, then targeted imaging can make sense. But scanning your whole body just in case is like searching for treasure with a landmine detector. You might find something small, but the collateral damage could be devastating. The real path to prevention isn't in high-tech scans, but in common-sense living. Stay active, eat well, sleep deeply, and work with your doctor to choose tests that are clearly necessary. Less can truly be more, especially after 70. And now I'd like to hear from you. Have you or a loved one ever gone through a medical procedure that turned out to be unnecessary or even harmful? Share your story in the comments below, because your voice might help someone else avoid the same mistake. We've now walked through 5 medical checkups that, while common, may quietly harm seniors more than they help. From the bone density scan that can push healthy people onto risky medications, to the brain MRI that fuels anxiety without improving memory, to the cardiac stress test that leads too many into unnecessary heart procedures, to colonoscopies that cause more complications than lives saved, and finally to the full-body CT scan that exposes patients to dangerous radiation and needless surgeries, the message is clear. After 70 more testing does not always mean more protection. Sometimes it means more fear, more cost, and more suffering. So what can we take away from all this? First, medicine is powerful, but it is not perfect. Tests and scans are tools, not guarantees. They should be used wisely, not automatically. Second, your health is more than numbers on a screen. Real prevention comes from lifestyle, staying active, nourishing your body with the right foods, sleeping deeply, and surrounding yourself with community and purpose. These choices lower risk far more effectively than many invasive procedures ever could. And third, you have the right to ask questions. Before agreeing to any test, ask your doctor, what happens if this test finds something? How will it change my treatment? What are the risks? If the answers are unclear or the benefits are small, it may be better to say no. This isn't about rejecting medicine. It's about reclaiming control over your health, about choosing quality of life over unnecessary fear. Modern healthcare can save lives, but it can also overwhelm us with interventions that do more harm than good. After 70, wisdom means knowing the difference. Now, we'd love to hear from you. Have you or someone you love ever gone through a medical test that turned out to be unnecessary or worse, harmful? Did it change the way you think about routine checkups? Share your experience in the comments below. Your story could be the one that helps another person pause, think, and make a safer choice. And if this video opened your eyes, take a second to like it so more people can discover these hidden truths. Subscribe to our channel for future videos where we'll continue to uncover what really matters in senior health and what doesn't. Finally, share this video with a friend or family member over 70. You might be giving them not just information, but peace of mind and perhaps even a longer, healthier life. Remember, real health is not measured by how many tests you take, but by how you live each day. Less can truly be more, and sometimes the best choice for your health is the simplest one to live fully. Fear less and choose wisely.